What's up, family? Here's a quick little movement break to help you take care of your shoulders. So let's just start by bringing your arm to your side and then just squeezing the back of your shoulder here and really externally rotating. All right, so each time you do it, think about really squeezing these muscles back here. All right, so just externally rotate and pull that shoulder back each time, squeezing that muscle nice and hard. All right, so we're keeping that elbow tucked in at the side to begin with, and then we'll kind of bring the arm up out to the side as we move. Okay, so bring it out to the side a little more here. The back of the shoulder and the back of the shoulder blade is an area that I find gets really weak with all of my shoulder patients. So if we take care of this early, this is really going to help prevent you from having any sort of rotator cuff injury or any sort of chronic shoulder pain. All right, so let's go up to shoulder height here and now really squeeze that muscle in the back. Amy just got back from a half marathon. Good shit, babe. All right, so really squeeze the back of that muscle there. Squeeze that shoulder in the back, all right? Just flex that muscle there, nice and tight, okay? So now we're gonna start with our arm up here and we're just gonna pull up at shoulder height. Again, we're thinking about that exact same area right here, okay? So pull that shoulder back, squeeze that muscle, all right? All we're doing is really bringing attention to the back of the shoulder and squeezing those muscles, all right? My shoulder is really getting tired. I can feel those muscles firing up in the back there. All right, so we're just pulling out here. This is like kind of like a high row motion. So if you guys have like any sort of bands, you could do this with a band, or if you have a TRX is really good for these ones here. All right, so let's go over to the left side. Start in, elbow at the side, squeeze that muscle out to the side. All right, so we're training our external rotators right here. We're training our infraspinatus and our teres minor, which are in the back of the rotator cuff, all right? I'm telling you guys, every patient that has a shoulder injury that I see in the clinic is weak in this spot, all right? So let's take care of it. Let's get ahead of the problem. Let's stay ahead of the problem. Simple stuff, right? We just gotta be consistent, we gotta be mindful, and we have to be constantly checking in with our bodies here. All right, so squeeze that muscle in the back. We're bringing more body awareness to this area that sometimes we lose awareness to. All right, guys? So get that external rotation. All right, let's come up to shoulder height now. Again, bring that shoulder into external rotation here, and each time you go, you're squeezing that muscle in the back. Don't squeeze so hard to the point where it hurts. Just squeeze to the point where you get a nice strong contraction and then relax, okay? So get into that external rotation here. Nice and easy, good. Now we'll go for our high row, all right? So it's like you're just pulling back at shoulder height, and again, we're bringing awareness to this spot right here. Think about that muscle right there, those muscles, all right? Pull that shoulder back, hold it, and squeeze. Pull back, hold, and squeeze. Pull it back, squeeze that muscle back there. Guys, we are protecting our shoulders here and making it much less likely that we're gonna have chronic shoulder pain, all right? Good, give it a good squeeze. The problem with a lot of shoulder injuries is our shoulders get pulled too far forward. The muscles in the back get weak. So this is our way of trying to prevent that from happening by pulling that shoulder back and strengthening these guys in the back. All right, give that a try. I'll see you guys later.